Hi everybody, welcome to my YouTube channel Dr.Sreenivas Medical Concepts and my FB page Dr.Sreenivas Concepts. This is Dr. Sreenivas, neurologist from Rajahmundry, Andhra Pradesh, India. My email is 3klpm@gmail.com. I am also the medical author of the two books Focused Neurology and Exam Oriented Clinical Neurology. We are continuing with a series of lectures of Prime Neurology. There are going to be 50 episodes of Prime Neurology, and if one listens to all these 50 episodes of Prime Neurology, one would have acquired a good knowledge of neurology. Right now we are on part 39, Prime Neurology, CNS infections, part 4, Cerebral Malaria. So in this episode we are going to discuss cerebral malaria. Cerebral malaria. Cerebral malaria complicates about 2% of cases of malaria due to Plasmodium falciparum. This is a rapidly fatal disease characterized by headache, seizures and coma with diffuse cerebral edema and very rarely hemiplegia, aphasia, hemianopia, ataxia or other focal neurologic signs. How does cerebral malaria occur in Plasmodium falciparum? Because once there is Plasmodium falciparum infection, the cerebral capillaries and venules are packed with parasitized erythrocytes and the brain is dotted with small foci of necrosis surrounded by microglia. So the cerebral capillaries and venules are packed with parasite erythrocytes, and therefore it is like ischemia to the brain because blood flow becomes sluggish because the capillaries are packed with parasitized erythrocytes. It is basically hypoxic encephalopathy. Usually the neurologic symptoms appear in the second or third week of the infection, but they may be the initial manifestation. The CSF may be under increased pressure and sometimes contains a few white blood cells, but the glucose content is normal. Cerebral malaria management, the pharmacological management. So since it's an emergency, we give artesunate IV. The first dose is on admission, that is loading dose at 0 hours. The second dose is at 12 hours. Third dose at 24 hours. Then once a day until the patient is able to tolerate oral medication, then give a full course of oral ACT. So but what is the dosage? In child less than 20 kgs, we give 3 milligrams per kg. In adults and children more than 20 kgs, we give 2.4 milligrams per kg. So 2.4 milligrams per kg at 0 hours, the first dose, at 12 hours the second dose, at 24 hours third dose, then once a day until the patient is able to tolerate oral medication, then give a full course of oral ACT. So once coma and convulsions supervene, 20 to 30% of the patients do not survive. It has been stated that larger doses of dexamethasone administered as soon as cerebral symptoms appear may be life-saving. Elevated CSF pressure should be relieved by appropriate measures. So summary of cerebral malaria. So malaria could be uncomplicated or complicated. Complicated gives rise to cerebral malaria. The Plasmodium damages the blood-brain barrier. The cause is Plasmodium falciparum. The clinical features are coma and seizures. The diagnosis is by microscopy. The management is intensive care and artesunate. The prevention is anti-malarials, insecticide treated mosquito net. So these are the wonderful concepts of the cerebral malaria. The other important concepts of clinical neurology, I put it in a book called Exam Oriented Clinical Neurology, written by me, Dr. Sreenivas, published by White Army. This book will be very useful for students appearing for clinical neurology exams. The other book I wrote is Focused Neurology, written by me, Dr. Sreenivas, published by CBS Publishers and Distributors. It contains all the essential elements of theoretical neurology in a question and answer format. So this book will be very useful for students appearing for orals or viva. This book is available online from all leading booksellers including Amazon. So if interested, this book could be purchased online. So these are the wonderful concepts of cerebral malaria. As I said, there are about 50 episodes of Prime Neurology. Just now I am done with another episode of Prime Neurology, that is cerebral malaria. So if one listens to all these 50 episodes of Prime Neurology, one would have acquired a good knowledge of neurology. So if you have liked this channel, please like, subscribe and share my YouTube channel Dr. Sreenivas Medical Concepts, which is India's leading neurology educational YouTube channel, and my webpage Dr. Sreenivas Concepts. Thank you. Bye.